In our first story, Uganda is in its fourth phase of the COVID-19 transmission, and that's the community phase. And experts are worried that if we do not follow the SOPs, there's likely to be a sharp spike in the infections. Now, Raymond Mujuni traces the journey that led Uganda to where it is right now and what we urgently need to do. Let's take a look.
At the National Referral Hospital, the beds are full. Treatment of the deadly COVID-19 is ongoing. Each patient now spends on average 10 days before making a full recovery. Uganda's COVID-19 numbers are on an upward trajectory. By press time, nearly 30,000 cases had been confirmed, but less than half of those have made a full recovery. Painfully, 228 others haven't beaten the virus.
We have in the previous 2-3 weeks seen a surge in the number of new infections, individuals who have COVID-19. We have also seen now a growing and increasing number of people dying as a result of COVID-19.
Why is this number worrying? It took Uganda almost 5 months to get its first 2,000 cases, but now, in an average of 10 days, the country is registering almost the same number of cases.
So previously, during the lockdown days and slightly after, government was at the forefront. So all the interventions, the lockdown and enforcement was so much on government. The current state that we are in requires individuals to take their personal responsibility, them knowing that there is a risk.
Uganda's health ministry is spearheading the country's fight against the pandemic. They are overwhelmed, out of resources, and fighting against a belligerent public for whom the pandemic is a politicized matter.
It's also important for them to know that they can easily get COVID as they look for votes. So it doesn't carry any meaning why somebody should be at risk of getting that disease, and all of a sudden, maybe during the process of being sworn in, we hear that so-and-so has died as a result of COVID-19.
With the Christmas holiday bell tolling, the ministry is moving to urge members to desist from going back to the villages and hosting large gatherings. Uganda is in stage 4 of COVID-19, which is characterized by rising community infections that are hard to trace. With close to 30,000 cases of COVID-19 confirmed in the country, definitely the curve for Uganda is still going up. That's because many Ugandans do not follow the basic SOPs. Wear a face mask, wash your hands regularly with soap, and sanitize. Now, the heart of this belligerence is that we can either act now or perish as a community. The choice really is boiling down to you and I. Raymond Mujuni for the joint COVID-19.